The way we've treated heart valve disease in the past has always been open heart surgery, but more recently we've come up with new innovations to treat valve disease minimally invasively. This is known as the TAVR procedure, where we can replace an aortic valve that is malfunctioning through small incisions in the groin and have the ability to avoid a large sternotomy scar and allow the patient to recover more rapidly and quickly and resume activities as they were just prior to the procedure. Patients who have aortic valve disease can present with a multitude of symptoms, including shortness of breath, chest pain, lightheadedness, or exercise intolerance. These are important to recognize, given that they can often be misconstrued as old age, when in fact they may actually represent significant disease of an aortic valve. A TAVR procedure is a transcatheter aortic valve replacement. It is a minimally invasive approach to replacing a diseased aortic valve. It is a procedure where we are able to replace the aortic valve with a bioprosthetic PIG valve through a small entry point within the patient's leg. Transcatheter aortic valve replacements used to be limited to patients who were deemed high risk for open heart surgery. However, more recently, data has shown that transcatheter aortic valve replacements can be successfully implanted in those that are even low risk for open heart surgery. At present time, we discuss all our cases in a heart team conference, which includes an interventional cardiologist such as myself, as well as a heart surgeon, and we come up with a collaborative agreement on what is best for the patient. Recovery time after transcatheter aortic valve replacement is minimal. If everything goes as expected, we anticipate patients going home the day after the procedure. They can resume all activities they were doing prior to the procedure immediately after the procedure as well. In contrast, individuals undergoing surgical aortic valve replacements have a prolonged recovery time, including several days in the intensive care unit after their procedure, followed by several weeks of rehabilitation. After replacement of the aortic valve using a TAVR procedure, we can expect the patient to have significant improvement in symptoms related to aortic valve disease. Patients who once were disabled and unable to function in society are able to return to normal activities almost immediately after the procedure.